Diseases are notorious, creepy strangers that infiltrate your body and cart away your wellness, and they come in different shapes and colors. In fact, they run into thousands in number. But just as you know, not every news makes the headline. So here are the major diseases you've got to keep in mind. Pneumonia occurs when bacteria, viruses, or fungi inflame the air sacs in the lungs. It often spreads when people cough or sneeze, thereby releasing the beastly disease into the air. If you're unlucky enough to inhale bad air and are infected with pneumonia, you may begin to experience cough, chest pain, shortness of breath, fever, and fatigue. Pneumonia can be life-threatening for individuals with weakened immune systems. Poliovirus, extremely contagious and goes straight to attack the nervous system. This disease is very creepy as it forces its way into the body through contaminated food and water or contact with infected persons. At the initial stage, you may not show symptoms but may soon experience fever, sore throat, and headache. In severe cases, paralysis can occur. Chickenpox, caused by the varicella zoster virus, is a common childhood illness. It spreads through respiratory droplets or contact with fluid from infected blisters. You should really avoid contact with anyone infected with this disease. Symptoms include an itchy rash of fluid-filled blisters, along with fever, headache, and fatigue. While generally mild in healthy individuals, chickenpox can take advantage of a weak immune system and expose it to more serious health complications. Meningitis inflames the protective membranes around the brain and spinal cord. This happens most times because the body is exposed to viruses, bacteria, or other pathogens. The major way you can get infected is if you have direct contact with an infected person's saliva, nasal discharge, or body fluids. Should this happen, you'll most likely experience a stiff neck, along with severe headache and fever, and you may lose coordination and often appear to be confused in some cases. Yellow fever, transmitted by mosquitoes, and has a free flow of operation in tropical and subtropical regions of Africa and South America. This disease is way worse than malaria and does not take time to show its negative sides. Symptoms typically appear 3 to 6 days after infection, starting with high fever, headache, muscle and back pain, nausea, and vomiting. In severe cases, the skin and eyes may turn yellow, accompanied by serious bleeding and organ failure. If proper medical attention is not in place, it can often result in death. Measles. The measles virus spreads through coughing or sneezing of infected individuals. This dangerous disease knows no age limit, as it can deal with both young and old, although it is quite more popular in children than adults. Symptoms typically include high fever, cough, runny nose, bloody red eyes, and rashes to top it up. Measles can also result in complications such as ear infections and pneumonia, with the most severe cases involving brain inflammation. Gonorrhea, a sexually transmitted infection caused by bacterium Neisseria gonorrhoeae. It typically spreads through unprotected sexual activities with an infected person. Symptoms of gonorrhea include painful urination, unusual discharge, and intense itching. It is advisable to protect yourself, however, if you experience any of these symptoms. Seek medical attention promptly to prevent complications and stop the spread of infection. Syphilis. This sexually transmitted infection is caused by the bacterium Trypanosomiasis pallidum. In its early stage, it often appears as a painless sore, but if you decide not to treat it, it can progress to a rash, fever, and swollen lymph nodes. If left untreated, syphilis can cause serious complications affecting the heart, brain, and other organs. Early diagnosis and treatment are crucial to prevent long-term health issues and to protect yourself and others from the spread of the infection. Ebola, caused by the Ebola virus and spreads through direct contact with infected bodily fluids or contaminated objects. It's crucial to avoid contact with anyone infected. But how do you know? Symptoms typically start with fever, headache, muscle pain, and weakness, progressing to vomiting, diarrhea, and internal bleeding in severe cases. When you see these things, just avoid such people. Ebola is highly dangerous and can lead to death, so immediate medical attention is essential if you suspect exposure or experience symptoms. Coronavirus, prevalent from 2019 to 2021. Coronavirus sparked a global culture of hand washing, sanitizing, and social distancing. It is sponsored by various strains of the coronavirus family and spreads through droplets from coughing, sneezing, or talking. Symptoms vary from mild to severe, including fever, cough, shortness of breath, and fatigue. With time, slow reggae can turn to fuzzy jazz, and things can progress to pneumonia and organ failure, which can eventually lead to death, like many cases during the pandemic period. Sickle cell disease, a genetic issue that occurs from incompatible genotypes. If two people with AS and AS, AS and SS, or SS and SS genotypes have a baby, there's a risk the child will have sickle cell. This happens due to a mutation in the HBV gene, which affects hemoglobin in red blood cells. These cells become sickle-shaped, making it hard for blood to flow properly. This leads to repeated painful experience, often called crises, where the affected person goes through ugly stuff like anemia, infections, exposure to various forms of health challenges, and delayed growth, especially in children. Cholera, a bacterial disease caused by Vibrio cholerae, and often spread through contaminated food and water. If you're not serious about your personal hygiene, then you are a potential cholera patient, as this disease flourishes in areas with poor sanitation. Symptoms include diarrhea and vomiting, which mostly happen at the same time. It's weird, yeah? But it's true. And since you're passing out all your food and water at such a fast rate, you may also experience severe dehydration, which can be life-threatening if not treated promptly. Tuberculosis, commonly known as TB, is an airborne disease caused by Mycobacterium tuberculosis. It spreads when infected people cough or sneeze, releasing massively destructive bacteria into the air. If you're in a crowded area, cover your nose and mouth to protect yourself. Or you also may soon begin to show signs of bloody coughs, weight loss, and night sweats. It's essential to be aware of these signs and take precautions, especially in crowded places, to prevent the spread of this serious disease. Tetanus, a dangerous infection caused by the bacterium Clostridium tetani, which enters the body through untreated wounds and cuts. Whenever there is a wound, it is advisable to clean it properly and cover it up before creepy tetanus finds a home in it. If it should, then you're in for some party. Initially, symptoms may include muscle stiffness, spasms, and difficulty swallowing, often starting mildly. However, tetanus can quickly escalate to more severe symptoms like jaw locking and can be life-threatening if left untreated. HIV/AIDS, a deadly disease with no cure. It's caused by a virus that attacks immune cells and spreads through bodily fluids like blood, semen, vaginal fluids, and breast milk. HIV, or human immunodeficiency virus, weakens the immune system. If not diagnosed and treated on time, it can lead to AIDS, or acquired immunodeficiency syndrome. You may begin to feel early symptoms such as sore throat, fever, and fatigue. These are mild and unsuspecting, but with time, severe fatigue, weight loss, and frequent infections may occur. Without timely treatment, only management can keep you alive. Advanced stage cancer. Despite extensive research, the exact cause of cancer remains unknown, and it remains incurable. Although lifestyle factors like smoking, unhealthy diets, and exposure to toxins are linked to cancer, they are not definitive causes. In advanced stages, malignant cells grow and spread, causing severe damage to the body. Symptoms include persistent pain, weight loss, and difficulty breathing. A near-death symptom sets in when the hair on the head begins to fall off. Though treatments like chemotherapy, radiation, and palliative care can manage the disease, they cannot cure it. Eventually, cancer often claims the lives of its victims. Type 1 diabetes. This occurs when the immune system attacks the body's own beta cells and the pancreas, leading to a lack of insulin and shooting up the level of sugar in the body. The exact cause is unclear, but it involves genetic and environmental factors. If affected, you may begin to experience increased thirst, frequent urination, and weight loss, and your sight may soon become very blurry. The body can't maintain balanced sugar levels, risking heart disease and kidney failure. Managing type 1 diabetes requires insulin injections and lifestyle adjustments, as there is currently no cure. Leprosy, caused by the bacterium Mycobacterium leprae, is a deadly and stigmatized infectious disease. It spreads through respiratory droplets, primarily affecting the skins and nerves. Early symptoms include light or dark patches on the skin and muscle weakness, and sometimes this can lead to numbness. As the disease progresses, nerve damage causes skin changes and loss of sensation. Leprosy can result in physical deformities, leading to stigma and social isolation. Rabies, a deadly illness contracted from animals like dogs, bats, and foxes. If you're an animal lover or keep pets, be cautious, because if your cute little pet gets infected and playfully or violently bites you, the saliva can mix with your blood, causing rabies. Symptoms start with flu-like feelings, such as headache and fever. As it progresses, you drool extensively, and in severe cases, experience paralysis and coma. Always be careful around animals and seek medical help immediately if bitten. Trypanosomiasis, the famous disease known as sleeping sickness, as it makes you sleep uncontrollably. It starts with a bite from a little buzzy tsetse fly, transmitting trypanosoma parasites into your body. Initially, you may feel feverish with aching joints. Without proper care, your system can lose coordination, leading to excessive drowsiness and sleepiness. If untreated, this can progress to a coma, and you may die while others wait for you to wake up. Lassa Fever, This is caused by the Lassa virus, which spreads through contact with infected rodents or their droppings and can also pass through direct contact with infected individuals. Symptoms include fever, headache, muscle aches, and profound fatigue. In rare and severe cases, it can progress to hemorrhagic fever with bleeding and damage to internal organs.